the primary endpoint for this trial was disease-free survival, and we did see indeed a statistically significant improvement in disease-free survival in the experimental arm that included pembrolizumab. So the 2-year disease-free survival rate in the control arm was 52%, and in the experimental arm with pembrolizumab, it was 67%. So that's a 15% absolute improvement in disease-free survival at 2 years. The other way that we look at this is by a hazard ratio, which the hazard ratio was 0.61. Even before the publication had come out, just based on ASCO presentation in June, that many medical oncologists had started incorporating this into their practice, particularly at places where chemotherapy is not commonly used. So they, for patients that they deemed to be at higher risk, specifically grade 3 is where we saw greater effect size. I think that grade 3 disease was really what was driving the improvement in disease-free survival that we saw. So this is really where it's being incorporated as for grade 3 undifferentiated pleomorphic sarcoma or dedifferentiated pleomorphic liposarcoma, adding pembrolizumab in the upfront setting and then also after surgery. But I think that the next steps for optimization really are another key point. Since many institutions use chemotherapy, there's been a lot of discussion, particularly in Europe, about having another clinical trial that would include immunotherapy and chemotherapy. And we don't know if the chemotherapy, by its immunosuppressive effects, would actually counteract the immune therapy, or some chemotherapies, including those used for soft tissue sarcoma, have been shown to cause immunogenic cell death. So perhaps there would be a cooperative effect or even synergistic effect. But that really will need to be experimentally tested, because we can't say from this trial whether the pembrolizumab or other anti-PD-1 therapy would improve or worsen the outcomes with chemotherapy. The other trial design that's under consideration is considering dual immune checkpoint blockade. So pembrolizumab just targets PD-1, but there have been some early studies looking at anti-PD-1 therapy with anti-CTLA-4 therapy. And so that is another combination that's under consideration for a future randomized trial.